I have the pleasure of interviewing MaryEllen Reider, co-founder of Yarlap, an American company that designs an FDA-cleared AI device for pelvic floor muscle tone. The AI technology in Yarlap provides women a way to regain pelvic floor muscle control without narcotics, surgery, or skill in performing pelvic floor Kegel exercises with fantastic results. AutoKegel is the registered mark of the technology, and the AI is so effective that patients can relax or perform other tasks during their pelvic floor workout. Thank you so much for doing this with us, MaryEllen. What is your backstory?
Thank you so much for having me. I'm so excited to be here. So our backstory is that Yarlap has these patents for security and safety, and we really focus the AI technology to strengthen and reinforce a positive patient-doctor relationship. And clinical studies indicate that even with guidance from a healthcare professional, women, for a majority part, women actually are unable to do a pelvic floor exercise correctly. So what the Yarlap does is it has AutoKegel AI technology that sends a precise impulse into the muscle to tell it to move comfortably and safely every single time. So we're really here to kind of help reinforce that relationship that women have with their healthcare professional. So that's what we do.
Can you share the funniest or most interesting story that happened to you since beginning your company at Yarlap?
Yeah, so for us, it's all about enthusiasm that women have for AI technology. And since we have this FDA-cleared device to treat incontinence, it's phenomenal when we get women who call us in and tell us that they've not only regained bladder control, but they've also had all these other benefits as well. And we really love it when they call in and they tell us these newfound control and improvements in their sexual performance and in their sexual expression. We have women literally of all ages. We've had women in their 80s call and tell us about their bladder control and then improvements in their sexual performance and experience, and it's the greatest thing. And I think that that's the most interesting thing is women not only coming in to tell us about treating their incontinence, but also all these other benefits that they're getting. It's really great. That's probably my favorite.
What do you think makes your company stand out? Can you share a story?
Yeah, so for us, I think that Yarlap really stands out in its efficacy, its safety, and the security that really went into the design of the product. The AI in Yarlap is at the highest point of pelvic floor muscle stimulation therapy research and development. So we have medical equipment that you might have, medical equipment that is simply just like copying technology. Is copying without understanding. And for that could really lead to a few things like inadequate assessment of risk, undesirable misadventure by whoever is doing it. And for us, it's really important that one, the patient's data is always kept private. That's incredibly important to us. We don't have wireless transmission of data or any of that. And two is to consider the risk associated with the transmission of that data, right? So it's, battery, a lot of great things now have lithium batteries in it, but lithium batteries are powerful and they're lightweight, but they also have a common problem of having intense heat, and that's actually called thermal runaway. And so we don't have that because it's just, we don't want to do anything that might risk anybody. So for us, it's all about security and safety, and that your privacy is always kept number one. And I think that that's something that we really take pride in because it's incredibly important to us.
Great. Are you working on any new or exciting projects now?
Yes, we are. So we are right now in clinical trials for the Yarlap in a leading research institution regarding sexual performance and expression, and our patents are underway for these phenomenal benefits that come through muscle control and motor skills that I talked to you about earlier, with these women who are calling in and telling us these great things. So that's in the works.
And what advice would you give to other CEOs or founders to help their employees to thrive?
I think that what I would say to them is that medical device design is not somewhere that you really showcase yourself, and it's not a stage. You really have to abide by FDA guidance, follow the rules, don't be a show off, just really be a stickler when it comes to that guideline. And then another thing for sure would be, don't, just because somebody doesn't have what you would imagine their qualifications to be, don't disregard them because of it. Because for me, I actually went to school at Maine University in Ohio for Japanese language and literature. And then I also had another degree for international studies. And so for when you're thinking about like marketing and all this other stuff, you usually think of like a finance, an econ, an accounting major, a marketing major especially. And you wouldn't think about people who have my kind of credentials. But for me, it's a little bit different because I come at it through a different way of viewing things. It's more of a different perspective of how to fix a problem. So we have, not only do we have engineers and, accountants and marketing people, but we also have people who studied in humanities as well. And it's all about finding a solution to a problem and how you come about it through different ways of looking at things. Because, just because there's a problem, right? And if you have different people who come to a solution through different ways, but it's all the same solution, it's like this great feeling, and it gives you a lot of security. So I would really say, don't nix people just because they are not who you would initially think should have that position.
None of us are able to achieve success without some help along the way. Is there a particular person you're grateful towards who helped you get to where you are? None of us are able to achieve success without some help along the way. Is there a particular person that you are grateful towards who helped you to get to where you are today?
Well, I'm always impressed with how smart and wonderful people with in this like diverse field and in this research, all come together, and how you all meet them. And it's all about networking and the power of the connection that all these people have to come together. And I think that that's just like a cumulative thing that I'm really appreciative of, is that there's all these people within this field who are trying to use their expertise and their knowledge to really benefit women's health and pelvic floor health in general. And I think that's I'm thankful for all of those people who've really, put their nose to the grind and really done their work.
How have you used your success to bring goodness to the world?
Well, when it comes to women in the United States, 1 in 3 women actually suffer from bladder leaks. So we're really trying to make sure that we help those women who are suffering from it, who are, using all sorts of products to mask the issue and not really treat the problem because they're not sure how to treat the problem. And I think that our AI technology empowers these women with, wellness and knowledge and the know-how and muscle control to really stop the leaks and stop all those issues. And I think that the big benefit and a dynamic, I guess, to it all is that we also provide learning as well. It's not just a solution. You're really knowing what's going on with your body and how to improve it and how to get all these controls step by step almost. So I think that that's, learning to work out your muscles, learning how to relax them, and all these things are really, really great that, our Yarlap with AutoKegel is teaching these women to kind of take their wellness into their own hands and being, self-initiated. I think that that's fantastic.
Can you share the top 5 ways that technology is changing the experience of going to the doctor?
Yeah, I think that, well, first of all, I think that AI technology has really strengthened that patient-doctor relationship. When it comes to pelvic floor issues, as many as 70% of women who visit a healthcare professional for that issue never come back. And I think it's, data suggests that it's because they're not seeing the results that they want to have, that they're not sure if they're doing the Kegels correctly and all these other things, because that muscle is incredibly hard to isolate and work and improve. And it's really hard to do it when you're by yourself. And I think that that's something that we do really, really well, is that we make sure that that bond between the doctor and the patient is strengthened, because you know that you're doing it correctly, you're getting the results. And that really, really helps. And I think that that's a way that AI has definitely improved the healthcare arena. The second one is that AI technology is also gives the patient physicians wish to treat the cause, not the symptom. So, you have all these issues going on. You have leaking in your pants and all these other unwanted things. And most people think that if you stop the peeing by, using a certain product or whatever, that's the end of it. But the root cause is actually a weakened pelvic floor muscle, because when it weakens, your organs, shift. That puts a lot of pressure on your bladder, and that's where all this, is the root cause. So with that technology, you're kind of nipping the problem at the root, and you're getting rid of that. You're not just, putting Band-Aids on all the symptoms. You're really taking it out. And I think that's the second thing. The third thing is AI technology can liken nature solutions. So like I said, you really want to respirate that muscle, you want to exercise it, you want to help it. And because of that, you're going to want to exercise and strengthen the pelvic floor muscle to, nip the root cause. So I think that when you do that and you're doing it naturally, you're not doing it without, pharmaceuticals or anything like that, you're really doing what nature wanted you to do with your body. The fourth thing is it can teach you. So we actually have a signal inside of the Yarlap that is sent out. And it's a precise signal to tell your muscles to move, because a lot of the times that signal gets lost if you have a weakened pelvic floor or what have you, from stress or strain. And what we do is we actually teach that solution back into your muscles. So you get that pelvic floor muscle control back again, and you know what to do, you know how it feels, you know what it should feel like when it's not doing it, when Yarlap's not doing it for you. So it's not only, your training wheels, but it's also, it's teaching you to do it on your own so that you're not constantly relying on something. And I think that the fifth is that AI technology can maximize the use of the patient and the physician's time, because when you're doing these pelvic floor muscle re-education exercises, you have to do a lot of them on your own to even get the benefit. And it's almost like you have to constantly be doing it. Whereas, if you use something with AI technology like Yarlap, it does it for you, so you can do it basically in 20 minutes and you're done for the day, instead of constantly having to do it, wondering if you're doing it long enough, if you've overdone it, or if you're doing it correctly. The AI technology really maximizes your time, because it teaches you how to do it correctly and how to do it effectively, so that you're not only getting the results, but you're also not wasting your time. So I think that's the fifth thing, is that it really maximizes everyone's time.
Can you please give me your favorite life lesson quote?
Yeah. So I'm a big Tina Fey fan. So her quote, "Whatever the problem, be part of the solution. Don't just sit around raising questions and pointing out obstacles." I think that really stuck out with us, because, you read about all these statistics about women's urinary incontinence, and you're thinking, why is this not talked about everywhere? It's so common, and our pelvic floor wellness is so big in not only like our physical health, but how our self-confidence and all these other things, that why aren't we talking about this more often? And instead of pointing out all these factors and all these problems of what women could do, we decided to become part of the solution with Yarlap to kind of tell them what's going on and a solution of an effective solution.
Is there a person in the world or in the U.S. who you'd love to have a private breakfast or lunch with, and why? Because they just might be watching.
Yeah. So I would pick Kathy Lee and Hoda from NBC's Today Show. And since they're basically like a team, I'm sticking them together to be kind of like a duo as an answer, as a unit. And I think it's because they really bring humor and empathy to whatever that they're talking about. And they also do it with a glass of wine, which I find very relatable. And they're doing it in a way that that they're just like happy and it's upbeat. It's not like this dark issue. It's something that's fun and that's fixable. And I think that energy is really contagious. And when it comes to women's pelvic floor health, I think I hope that I come off that way as well. And I think that if I had lunch with them and we started talking about pelvic floor issues and all this other thing, I could change their minds and really like have that talk and bring that awareness, because I think that it's really important.
So thank you so much for your time today and sharing the great news with Yarlap being available on the market. And please follow Yarlap, and we'll include Yarlap website at the bottom of the screen. Thank you so much.
Thank you.